Hi friends, thanks for watching. I am Dr. Muhammad Usman. Now let's talk about Lantus Solostar. Lantus Solostar has insulin glargine in it. Insulin glargine products are used to treat type 1 diabetes, a condition in which the body does not produce insulin and therefore cannot control the amount of sugar in the blood. Insulin glargine products are also used to treat people with type 2 diabetes, a condition in which the body does not use insulin normally and therefore cannot control the amount of sugar in the blood, who need insulin to control their diabetes. In people with type 1 diabetes, insulin glargine products must be used with another type of insulin, which is a short-acting insulin. In people with type 2 diabetes, insulin glargine products also may be used with another type of insulin or with oral medications for diabetes. Insulin glargine is a long-acting synthetic version of human insulin. Insulin glargine products work by replacing the insulin that is normally produced by the body and by helping move sugar from the blood into other body tissues where it can be used for energy. It also stops the liver from producing more sugar. Over time, people who have diabetes and high blood sugar can develop serious or life-threatening complications, including heart disease, stroke, kidney problems, nerve damage, and eye problems. Using medications, making lifestyle changes such as diet, exercise, and quitting smoking, and regularly checking your blood sugar may help to manage your diabetes and improve your health. This therapy may also decrease your chances of having a heart attack, stroke, or other diabetes-related complications such as kidney failure, nerve damage, numb, cold legs or feet, decreased sexual ability in men and women, eye problems, including changes or loss of vision or gum disease. Your doctor and other healthcare providers will talk to you about the best way to manage your diabetes. Insulin glargine products come as a solution liquid to inject subcutaneously under the skin. They are injected once a day. You should use insulin glargine products at the same time every day. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Use insulin glargine products exactly as directed. Do not use more or less of it or use it more often than prescribed by your doctor. Never use insulin glargine products when you have symptoms of hypoglycemia, which is low blood sugar, or if you have checked your blood sugar and found it to be low. Insulin glargine products control diabetes but does not cure it. Continue to use insulin glargine products even if you feel well. Do not stop using insulin glargine products without talking to your doctor. Do not switch to another brand or type of insulin or change the dose of any type of insulin you are using without talking to your doctor. Always check the insulin label to make sure you receive the right type of insulin from the pharmacy. Insulin glargine products come in vials and in dosing pens that contain cartridges of medication. Be sure you know what type of container your insulin glargine product comes in and what other supplies such as needles, syringes or pens you will need to inject your medication. If your insulin glargine product comes in vials, you will need to use syringes to inject your dose. Ask your doctor or pharmacist to show you how to inject insulin glargine using a syringe. Ask your doctor or pharmacist if you have questions about the type of syringe you should use. If your insulin glargine product comes in pens, be sure to read and understand the manufacturer's instructions. Ask your doctor or pharmacist to show you how to use the pen. Follow the directions carefully and always perform the safety test before use. Never reuse needles or syringes and never share needles, syringes or pens. If you are using an insulin pen, always remove the needle right away after you inject your dose. Discard needles and syringes in a puncture-resistant container. Ask your doctor or pharmacist how to dispose of the puncture-resistant container. Do not dilute insulin glargine products and do not mix insulin glargine products with any other type of insulin. You can inject your insulin glargine in your upper arm, thigh or stomach. Never inject insulin glargine into a vein or muscle. Do not inject where the skin is thick, lumpy, tender, bruised, scaly or hard, or into areas of skin where there are scars or skin is damaged. Change the injection site within the chosen area with each dose. Try to avoid injecting the same site more often than once every 1 to 2 weeks. Always check your insulin glargine product label to make sure you are using the correct insulin and look at your insulin glargine product before you inject it. It should be clear and colorless. Do not use your insulin glargine product if it is colored, clouded, or contains solid particles, or if the expiration date on the bottle has passed. Do not use insulin glargine products in an external insulin pump. Be sure to follow all exercise and dietary recommendations made by a doctor or dietitian. It is important to eat a healthful diet and to eat about the same amounts of the same kinds of food at about the same times each day. Skipping or delaying meals or changing the amount or kind of food you eat can cause problems with your blood sugar control. Insulin Glargine products may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Redness, swelling, pain, or itching at the injection site. Some side effects can be serious. If you experience these symptoms, call your doctor immediately or get emergency treatment. Rashes, hives, or itching all over the body. Wheezing, difficulty breathing or swallowing, or a fast pulse. I hope you liked the video. Please like and share our channel, subscribe to our channel. Thank you.